Welcome back to the Neurology 101 series here on the ProPA podcast. I'm Dr. G, and today we're beginning a new umbrella category, movement disorders and cranial nerve syndromes. First up on our movement disorders subseries is one of the most common outpatient neurological complaints, the essential tremor. Let's dive in. Did you know that essential tremor is 8 to 10 times more common than Parkinson's disease? And while it's often thought of as benign, it can significantly impact the quality of life. Bonus fact: alcohol temporarily improves the tremor, a diagnostic clue you won't want to forget. Let's look a little deeper at the kinder patho. What is an essential tremor? Essential tremor, or ET, is a progressive, rhythmic, involuntary shaking, typically affecting the hands, head, or voice. It's considered a kinetic or action tremor, worsening with movement, not at rest. The exact cause is unknown, but it's thought to involve abnormal oscillatory activity in the cerebellothalamical cortical circuit. That's a tongue twister. Up to 50 to 70% of cases are familial. Autosomal dominant inheritance pattern is present. My grandpa actually had an essential tremor, and my mom now has one, a mild one. Clinical presentation. Classical features include bilateral action tremor of the hands or forearms. This may also affect the head, a yes, yes, or no, no tremor, the voice, or even the jaw. Tremor worsens with goal directed activity like writing, drinking, or eating, and it improves with alcohol in about 50% of the cases. No other neurologic signs, no rigidity, no bradykinesia, and no gait issues. It's important to distinguish from Parkinson's disease, where the tremor is typically at rest, asymmetrical, and accompanied by other features like rigidity or bradykinesia. So, how do we make the diagnosis? Well, it's primarily clinical. It's based on history and the physical exam. We want to watch for the tremor pattern. Is it postural or kinetic, not resting? Rule out secondary causes like hyperthyroidism and medication side effects. No required imaging, but MRI might be used to exclude structural lesions if an atypical presentation is there. And how do we treat it? Well, treatment's not always necessary. We really only want to treat if the tremor is functionally impairing. And first line pharmacologic options include propranolol, a non selective beta blocker, or primidone, a barbiturate anticonvulsant. Alternatives include gabapentin, topiramate, and Botox for head or voice tremor. In refractory cases, we can consider giving the patient a deep brain stimulator targeting the VIM of the thalamus. Other lifestyle modifications include reducing caffeine and stress and use weighted utensils or wrist weights. All right, book med versus street med. So the book is going to tell us you have a symmetrical bilateral tremor with movement, improves with alcohol, and treat with propranolol. Street med, your patient says, I can't hold my coffee without spilling it, but weirdly enough, after a drink of whiskey, I'm rock steady. That's not just a story, it's a diagnostic clue. Clinical pearls. ET is worse with movement, better with rest and alcohol. No gait abnormalities, rigidity, or postural instability. Don't confuse it with Parkinson's. It's symmetry and action tremor that help you tell them apart. Family history is often present, and propranolol or primidone are used for bothersome symptoms. All right, let's test ourselves. A 65-year-old man presents with bilateral hand tremors that worsen with drinking from a cup. His tremor improves after drinking a small amount of alcohol. What is the most likely diagnosis? Is it A, Parkinson's disease, B, essential tremor, C, Wilson disease, or D, cerebellar tumor? I'll give you a few seconds. If you said B, essential tremor, you are correct. Remember, it is an action tremor, bilateral, and alcohol responsive. Classic for ET. Which of the following medications is first line treatment for essential tremor? Is it A, levodopa, B, diazepam, C, propranolol, or D, ropinirole? The answer is C, propranolol. Propranolol and primidone are considered first line for functionally limiting essential tremors. Final thoughts. Essential tremor is common, frustrating, and often underrecognized. Knowing the pattern, bilateral, action-based, and alcohol improves can help you quickly nail the diagnosis and offer relief when needed. Next up in our movement disorders series is Parkinson's disease, the tremor you should never ignore. If this episode helped shake off some of the confusion about tremors, share with a classmate or preceptor. And remember, this is the ProPA podcast, where future pros in medicine are made. Until the next episode.